Hello friends, today we are going to discuss about school readiness in the context for children with intellectual disability. Yes, even intellectual disability have a right to study in regular schools. Even they have a right to participate in the mainstream schooling. So it is our responsibility as a special educator to make them ready so that they can participate in mainstream sit with their normal peer group. So before we discuss about school readiness, let us discuss about intellectual disability first. See, the child with intellectual disability is one who has arrest or incomplete development of mind. That means the brain is completely compressed in such child, and when it is compressed, the information will not process. Why it will not process? For example, let us say if you ask anything to the boy or a girl to come here, the information which you have asked come here, it may not process what you are exactly saying. So in that way, what happens, it will be delayed. That's why they also call developmental delay. So this result in impairment in the adaptive behavior of the child. So this result, this is an output. Adaptive behavior is an output of intellectual disability. You need to understand that. See here, normal child may have normal behavior pattern at each stage of their life, such as a walking independently, by 12 months, speak 2 to 3 words by 2 years, toileting control by 3 to 4 years. There are a lot of other activity where the normal child will do very easily when compared to disability child. But remember, intellectual disabilities cannot be cured. However, early detection, intervention, special education, and training can help to leave them independently to the great extent, so that they also can be a part of society, so that they also can be a productive member of their community, they also can earn. So our aim as a special educator must be to focus on their independency level. Three screening schedules, yes. So NIMH has developed the three screening schedules for 3 years, 3 to 6, and 7 years above. This will help you to identify or screen child very quickly, or whether the child has suspected to be an intellectual disability. So let us understand screening schedule number 1. They have given the numbering for each age group. Let us see this checklist. See, this is very clear. They have given the stage number. That means number 1 to number 11 are the stages, or you can see a number of items. Now, okay, and in the child progress, they have given you the description, like respond to the name and normal developmental age range and developmental delay. As I said you in the beginning, normal child can achieve very easily, like responding to their name, smile at others, hold head steady, sit without support. So these are the contents where the normal developmental child easily can do and in the normal pattern. Whereas if it is developmental delay child, okay, so he will be showing delay in those responses. So if the child is found to be delayed in any of these stages, let us stage number 1, number 2, number 3, then child has suspected, or child has a difficulty in maybe in eating, drinking, so that can be concluded, or it can be suspected that child has intellectual disability. Let us see screening schedule 2. This is designed for 3 to 6 years. It's very simple. In this, again you have number 1 to number 10, that is items, and simply you have to tick yes or no. If any of the above item is answered as, is suspected to have a intellectual disability. So it's very simple screening schedule. Remember, this is not a standard, I mean to say, this is not a confirmation that child has an intellectual disability. This is just a screening part where your suspicion goes higher and then you refer for the differential diagnosis. Then number 3 is about 7 year and above. So in this also you have the same procedure like your screening 1 and screening 2. Here also, if it's suspected that you have a child with intellectual disability, then you need to tick S. For example, if all S suspected to be intellectual disability, vice versa, either way you can, if it is suspected, you tick S. Okay, if child comes first to you and you try to ask the question to the parent stakeholder, and you tick all S, and then finally you conclude and you say there are a lot of S out of 8, 6 S's, that means the child may have intellectual disability. Sometime what happen, you suspect because on observation, but you haven't done screening, so again you will do the screening and then you will try to find out that your hypothesis was correct. So in that way you can do the screening. It's very simple and easy. Preschool teachers, yes, can help an important role in helping children with developmental delay. Exactly. See here, whenever the school teacher or class teacher or subject teacher are in the classroom, they may encounter such problems like seizure. I'm going to give only one example. There are a lot of other examples which you can explain. If you are a special educator, you can explain to your teachers so that they are aware of those conditions. See, seizure, it's a fit, relatively a common disorder which manifests in sudden uncontrolled or electrical activity. Yes, some sort of electrical jerking will happen in the brain. And what happens when jerking happens to be, the child shows these symptoms like twitching the eye, mouth turn, drool, he fall, he will be confused first of all, pulling his clothes, vacant look, clenching the teeth. So these are the common signs. So what teacher has to do? So teacher need to follow some do and don'ts. What are those? Keep calm, roll the child to a side, most probably left side, because as saliva comes down, because saliva must not be taken inside back, because again it will show or even it will destroy the brain. So in that way you need to explain to the preschool teacher so that they can understand, and make sure that clean, clear air must be given to the child. Avoid sharp objects. Don't give any sharp objects. Get medical aid. You need to get medical aid. You must not give medicine or water during that time of seizure. You must not force anything in the mouth. Okay, if not, it will become more tight and saliva may not come out. So don't try to stop the fit by holding the hand, holding the mouth, or because if you hold the hand during the process of feet, the blood will get clot. So make sure that you remember this and explain this. Do not move unnecessarily the child, moving from here to there during the process of seizure. It may hurt the child, it may lose the brain control again. So these are the don'ts which you need to remember before you encounter. Then intervention of children with mental retardation. It is very, very important. If you encounter, then how to handle the children with mental retardation. Now this mental retardation is called intellectual disability, and they have removed MR. Now it is children with intellectual disability. So let us see some of intervention techniques like concrete experience and example to understand concept. That is very, very important. Gestural communication, verbal prompt, modeling, physical prompt, task analysis, medical intervention in view of health issues. These strategies, there are more other strategies, but I have mentioned a few main strategies which helps to handle the children with intellectual disabilities, like concrete experience and example. You need to give a concrete real objects, so that they can understand the concept very easily. Gestural communication is like you know teaching them non-verbal communication. Verbal prompt, telling, you tell, they do. Modeling, I do, you do. Physical prompt, holding the hand and making the child to do. And task analysis, it's a best strategy. Task analysis is like breaking down your objective in a smaller component, so that they can understand, and then later it is arranged in the sequential logical order, and then you impart your teaching. That is very very important intervention strategy. Apart from that, you have a medical intervention. See, there are a lot of pediatricians who give the medicine by saying that the reading will improve, writing will improve. See, there are no medicine for reading, writing, arithmetic. Okay, we cannot what do you say treat these conditions like difficulty in reading or writing. Rather, they can improve their health issues. So make sure that you explain this better, you understand. First of all, don't indulge into false factors. Let us see educational classification of children with intellectual disability. This is also very very important. Let us understand, during the olden days there was a model called educable, trainable, custodial. So this was the model when there was no schooling and all these things. This was the model, like educable, trainable and custodial. So based on the level of the child, they used to place in those particular area. If child is educable, they will go for the educable. Like severe, moderate, they are trainable. And custodial, profound children are placed in the center based or home based, so that they can get some sort of training, or even sometime in what is a hospital. So that is very very important. You need to understand the change of scene. Now new methods are this: pre-primary, primary, secondary, pre-occasional. 100% you would have seen while doing your bachelor's in special education, you would have encountered such setups where you have a grouping based on the age group and the level of the child. So and they will have a specific goal to gain, and FACP is the curriculum where they have to use in that particular age group. So every primary, secondary, okay, pre-occasional have a curriculum. But now currently we are following inclusive education mainstream, where disabled children sit together with the normal children, and they try to work together, try to gain the knowledge together. So because they're also a participant of society, equality of society, which we need to talk about more and more. So this is the educational classification which has been changed time to time. Let us understand the characteristics of children with intellectual disability at school level. Now here you have to understand very clearly. Preschool, the age range is 0 to 5 years. In school age it is 6 years. So it has been divided. The classification of intellectual disability has a four area, like mild, moderate, severe and profound. So mild can develop a social skill at the age of 3 years when you send them to the preschool, because he will be interacting the lot of students at his own age or peer group. And see here, mild have that ability to gain the social skill very fast, rather the moderate, because moderate may have a poor awareness, severe may have very very poor, and profound very very poor. So moderate can talk to learn to communicate. It doesn't mean that mild don't know. Mild has the ability to talk as the socialization skill, whereas moderate can take or learn to communicate, poor social awareness. Whereas severe, they may have poor motor developmental and speech during that particular in the preschool age group. Profound, they will be delayed in all the areas, in all the functionality levels. So when this mild move to the school age, what happens? They try to compete, they learn academic skill, and they try to move on, and most of the time full-fledged they can pass 8th grade. But after 8th grade, due to accommodation modification, and they will reach up to 12th grade, which I have seen, and they also will get a profit from a training in the social moderate guys and occupational. So the moderate guys can achieve till second to third of till 5th grade in present scenario, because this is a standardized where they have done research. And severe can talk or learn to communicate. At least this severe guy, when they reach to the school age, they will develop that skill. They will try to communicate, they will start communication, they will learn the new habits, good health habits. And profound, when they are at the 6 plus, some motor development will be present. They will also develop some sort of ADL activities, self-help activities, so which is helpful. So this is the difference which you can see when the child reach at the level to level. As we said, developmental mind is that means it is the brain is compressed. That's why there will be delay in learning. So make sure that keep in your mind, even child with intellectual disability will develop the skills, but it will be delayed because of processing in their brain. So that is the main characteristics. Okay, now let us see. So, activities of school readiness. This is very, very important, which we were talking about initially before starting the presentation. So, you need to remember the 5 points before you select, the activity of school readiness. So, what are those 5 points? Let us see. Developing activities for school readiness among children with intellectual disability must be categorized in 3 levels, from level 1 to level 3. Very, very important, whatever the activity you take. So the division of this level do not restrict the teacher with the time limit. Remember that, because each level have their own specific time of achievement. You cannot fix 1 month. Okay, in 1 month I have to cover this objective. No, it cannot be happen, because the child is at 2 years or 3 years. When you specifically talk about children with intellectual disability, it may not achieve very easily, as they have a limited cognition. So you need to remember that. Then identify child's ability to perform the selected objective, or the activity you have selected, which your planned for, make the child ready to go to the mainstream. So you need to identify the child's ability, whether he has the ability or not. That is very, very important. One major characteristics which you always remember as a special educator is that Children with intellectual disability, they are slow in learning, demand longer time and repetition. So SDR, slow in learning, demanding long time, repetition of practice. They are very slow, they take more time, and they cannot learn in one or two attempts. It requires 10, 15, and as per the research, you have to repeat the same activity for at least 18 times so that it will go to their brain and get processed, and then you will receive the information. So that is very, very important. Then ability to generalize whatever you have learned, that has to be generalized when he goes out, when he talk to the some friends, whatever he has learned. So make sure that you remember these things and then you select your activity. So we are going to talk one example of activity. I'm going to take one example, and at last I'm going to give a suggestion, and in the same way you can plan it out to plan your intervention for the welfare of children with intellectual disability, or to make them ready to go to the school. So here I have taken a conversation. See, every activity involves interaction of verbal or non-verbal mode. Therefore, teacher and parent must involve together, initiate the training for the development of the child in the preschool age group. So make sure that you remember that, because each activity will have their own modalities. Let us divide this into different level. Level 1, for example, if you have taken a conversation, then what can be your level 1? Telling your name can be a level 1. Asking the child his or her name. Tell children in a group the name of the school. Let children tell about their home, name of the parent, and note the cleanliness and hygiene in children with intellectual disability, as a dress, bag, nails, hair, hand. So there are a lot of things which you can ask in the level 1, or you can teach in the level 1, because it's very basic. For example, see how it looks. So cleanliness, it should be very clean, tidy, so that you build the confidence to them, because conversation requires that. And in the what you say and also make sure that before starting you need to recognize the prerequisite skills. If you want to teach all this, telling your name, prerequisite, the current level of the child, is very, very important. Therefore, in the prerequisite skill, this kind of pictures you need to show, which belongs to the child, or like child photograph of family, that is very, very important, like self, father, mother, this kind of pictures you need to show, so that they can identify themselves and they understand that yes, this is his face. As I told you that they have a limited cognition, they require more time, number of repetition, slow in learning. So for example, you see in the first row, Raju, that means mother is calling a name Raju, and whereas Raju again has to respond it, that means that responders has to be taught. You need to identify whether the child has the ability to do it or not. And other pictures like uniform, shoes, socks, or any footwear, bag, these all you have to show and to find out the prerequisite skill whether the child has or not. And even you can use, if they don't have this, even you can use these pictures to teach. That is very, very important. Now in the level 2, what happened, you need to go little higher level, that is little higher way, that is discuss importance of hygiene and cleanliness. You have in level 1 you have just taken note on the cleanliness of hygiene, whereas here you're going to discuss the importance. Then teach children the ability to match the cloth with the help of matching colors. Discuss how color are helpful in selecting a vegetable, raw and ripe, like this way. See, so this child can identify with the help of smell, with the differentiate raw and ripe, color, touch, smell. So with the help of this, they can identify the, whether the fruit is good, or it got spoiled. So that is very, very important. Then discuss how important is to recognize the voice, of sound of a familiar person, vehicle, animals, etc. So here you can see few examples, like, dog says bow bow, but when the dog bites, action of the mouth while barking and eating, you need to be very clear. See, when they eat, how they eat; when they bark, how they bark. So these are the action which this child will try to run the sound and try to, modulate in his life to understand the conversation. And like cat, see, when the cat says how it open, or how, she open her mouth, and when they have a milk, then how they lick with the tongue. Okay, so how, what are the sound they make during the, drinking the milk. So that things you need to make them understand. Then level 3 is like encourage the children to talk about the object that are used by them for their own need. Like for example here, like brush, comb, food, they have to talk regarding this, because this all activity will help them to, build their conversation. Encourage the children to talk about the object that are there in the home, like this. So this is very, very important. So they have to talk some of the other things, so that, they develop their communication skills, they try to understand their conversation. So these are the 3 levels which you need to divide, and you go a higher and higher level. So I think you have understood. So before I end up, I just want to give some suggested activities for school readiness skills. You can plan, like, family members may encourage the child to name the object that has been used, him or her. Child can also be encouraged to name the object that are other used in household, or sand play, clay activities, water play, tear and cutting. So these are the activities which you can plan, with the child, and make the child to, and you can make the child to become ready to perform in the mainstream. And printing, then stories. So there are a lot of other activity which you can think, which is required during the, at the age of 5 when he goes to the school. So that's it about school readiness activity. So I hope you have understood, and then we will be coming with the other topic very soon. Till then, we'll see you, and bye bye.